Because we are dealing here with a South African icon, and there's always interest from not just South Africa but around the world, the South African government is being quite careful and cautious with its statements and what it's telling the media. We do have some sound just into CNN from the presidential spokesperson, Mac Maharaj. Let's take a listen to what he had to say to reporters.
The doctors are attending to him and ensuring that he receives the best possible expert medical treatment and is kept comfortable. President Zuma has wished Madiba a speedy recovery and appeals to the people of South Africa and the world to pray for our beloved Madiba and his family and to keep them in their thoughts. We have full confidence, says President Zuma, in the medical team and know that they will do everything possible to ensure Madiba's recovery. With Madiba and a person of his age, there always has to be concern. And therefore, the doctors, I think we need to appreciate, will prefer to work on the side of caution rather than take any risks.
And Mr. Maharaj has also said that he is receiving all of his information from Nelson Mandela's doctors, and he will update the public as those doctors update him. He says that those doctors need to be able to tend to Nelson Mandela. What we know is that he's been readmitted for this lung infection, a reoccurring lung infection that he was treated for back in December for 18 days. Earlier this month, he had a 24-hour follow-up and was allowed to be discharged from the hospital. So it is concerning that this is a lingering problem. It's also concerning that Nelson Mandela's 24-hour team isn't able to care for him, and that's why he had to be admitted to hospital. So at this moment, Manita, here in South Africa, we're all kind of waiting to hear what is the update on the health of this anti-apartheid icon, and as soon as we get more information, we'll certainly bring it to you.
Yes, we understand, as we were saying at the top of the show, that he was admitted to hospital just shortly before midnight Wednesday, early Thursday morning, we could say. And it's now been a few hours since he has been in hospital. No doubt he has already undergone some preliminary assessment and treatment. In terms of, and this is certainly a test, isn't it, for the government in terms of how they manage the kind of information that comes out of the hospital and how the kind of reaction the people of South Africa and the world will take this information.
Yes, and they are being continually tested, aren't they? The last time Nelson Mandela, before his bout in December with the lung infection, the last time he was treated was back in 2011, and the government has always been very tight-lipped because he is now a private citizen. But undoubtedly there will be scans and tests being done for Nelson Mandela, and when there is an update, we will receive it. But the government also is trying to respect the fact that he is a private citizen. His family and those close to him should be the first to be updated on his condition, and that Nelson Mandela is incredibly frail at 94 years old. Those close to him have been saying recently that his memory is starting to fade and he's forgetting that certain people that struggled with him against apartheid are no longer alive. So this is a fragile and frail old man who people here in South Africa absolutely love, and so the appetite for information on his health certainly is quite large, and the government knows that, so they are speaking to the press. They're kind of doing the rounds and giving as much information as they can, but they are pushing back a bit to say he's a private citizen. Let's allow the doctors to do what they need to. Mac Maharaj said this is not the time to go visit Nelson Mandela. He was asked if he had seen him. It's the time to let the doctors do their thing. So I'm kind of paraphrasing what he said, but he's kind of giving space and time for Nelson Mandela to be treated for this lingering, reoccurring lung infection, which for a 94-year-old could possibly be quite serious and fatal.